Welcome back, everyone, to our Research Connect series. My name is Aisha Adil. I'm a CDTRP trainee and a PhD candidate at the University of Toronto in vascular cell biology and bioengineering. I will be facilitating today's webinar. First, I would like to acknowledge that the CDTRP is hosted by the University of Alberta, which is located on Treaty 6 territory, traditional gathering place for diverse Indigenous peoples, including the Cree, Blackfoot, Métis, Nakota Sioux, Iroquois, Dene, Ojibwa, Saulteaux, Anishinaabe, Inuit, and many others whose histories, languages, and cultures continue to influence our vibrant community. I encourage you to write your land acknowledgement in the chat box. We would also like to acknowledge Estella's, whose generous support we could not have had to host these sessions without. Before we dive into the main content, I will pass it to Mary Claire for some general CDTRP updates.
Thank you, Aisha. We have one update today. So our innovation grant competition is coming up fast. The deadline is April 1st, 2025. The CDTRP is offering $30,000 in seed funding for innovative pilot projects related to donation and transplantation. If you're interested, you have until April 1st to submit your application. And I will put a link in the chat for you to easily access the application itself. Thank you.
Before I introduce the speaker, I have a few housekeeping notes to everyone. Today's session is recorded and posted on the CDTRP website and YouTube channel. During the presentation, please keep your mics off. If you have a question or comment, you can raise your hand with the raise hand button or type it in the comment section. And with that, I'm pleased to introduce today's speaker, Ms. Irene Chen, presenting on social media as a tool to explore mental health in children living with a solid organ transplant and their families. For background, Irene is an MSc student at the University of British Columbia in the Women Plus and Children's Health Sciences program under the supervision of Dr. Tom Blint-Hansen. She completed her BSc previously in biology and psychology at the University of Alberta. Her current research is exploring social media use among young people with transplants, specifically in relation to seeking and sharing information about mental health. I will now hand it over to you, Irene.
Thank you so much for the introduction, and thank you for having me this morning. I'm just going to go ahead and share my slides. Does this look okay to everyone?
Yes, you're good.
Awesome. Okay. So, as Aisha mentioned, my research is looking at social media and as a tool to explore mental health in children living with a solid organ transplant, and is a part of my thesis work here at UBC. So just some learning objectives before I jump into the bulk of the presentation. The first one is to identify patterns of social media use among pediatric SOT recipients and their families, as well to analyze the content and discussions surrounding mental health specifically and psychosocial issues among these patients. So it is quite well known that mental health challenges are present at higher rates in children with a transplant, and broken down, those look like higher rates of depression, anxiety, post-traumatic stress, which is a notable one, as well as ADHD. And this is typically compounded with other psychosocial challenges, such as peer and academic difficulties. And it has also been demonstrated that family members and immediate support networks of these children face similar challenges, as well as heightened amount of stress and disruptions in family networks. It is also quite well known that social media is highly used in young people and specifically has a role in children with chronic diseases. So it's shown to have a role in building community and forging social connections, as well as facilitate information sharing, both about information in general, but also information about disease progression and progress, as well as improving disease-specific knowledge. So serving as more of an educational resource in this case. And national metrics show that social media use is highly ubiquitous. I'm sure that's something that we've all observed in the children and adolescents in our life, but estimates show that approximately 50% of children, so children ages 6 to 10 years, use social media, and 85% of adolescents. And specifically, a recent study looking at social media use in 212 adolescents with a chronic disease showed that a high majority of this population expressed a need to share their illness experience with friends, to search the internet to find new therapies and discover their prognosis, as well as look for friends with the same disease on Facebook. So, showing that a high proportion of adolescents actually turn to online tools and social media as a means to gather more information about their illness or their disease, as well as to bolster that peer support network. So that brings us to the current study. So it's well known that social media is ubiquitous, and it's also well known that this population faces higher rates of mental health challenges. So the current study aims to explore how patients that have received an SOT during childhood and their families use social media to address their mental health needs. And that's broken down into three complementary aims. The first one to determine how pediatric SOT recipients and their families use social media more broadly, as well as to take a closer look at specifically topics about mental health and any psychosocial topics on social media, and also to uncover what information and resource needs are unmet to guide the dissemination of mental health resources online and support patients in navigating online spaces. So we approached this in a number of different ways, but the first one being a social media search and analysis. So we started with a comprehensive scraping of a transplant support group on Reddit. And this is one of the largest and most active transplant support groups on any social media platform, but we targeted Reddit specifically because of the disclosure-based posts that are posted on the platform, where users typically come on with more lengthy narratives about their experiences. So that really facilitated the process of the qualitative analysis that we did. But from this search, we gathered about 8,400 posts, and that was retrieved across a 10-year period and applied a set of inclusion criteria. So to be included in analysis, they had to be publicly available. They had to self-disclose as a SOT recipient or the family member of one, and had to self-disclose as being between the years of 0 to 24 years of age, or someone that received an SOT during that period. So after applying that inclusion criteria, we included 357 posts and about 5,800 comments in our final analysis. And our analysis had a couple different components. So it was both a content and thematic analysis, which first involved developing a coding guide. So this was a process that was done with two coders, so myself and a student, coding a subset of the sample until an intercoder reliability score of 75% was achieved. So we ended up coding about 20% of the sample to achieve this metric. And throughout this process, we had continuous discussion about how to align our coding or to make the coding guide more streamlined. So that involved collapsing or expanding certain codes, providing more detailed definitions, and also turning to our supervisors if there was continued discrepancy. Um, so once that coding guide was finalized, which was done once we achieved that 75% metric, then we split up the sample and recoded the entire sample set into our codes. And then a inductive content and thematic analysis was performed on the sample. So the content analysis was more so that surface level analysis, looking more so at frequency counts, not doing so much of that deeper narrative or thematic analysis. And then the thematic analysis focuses more on those deeper themes. So it tries to uncover underlying themes or ideas and is more interpretive rather than just kind of stating the different topics that come up, which is more characteristic of the content analysis. So we paired both in this study to try and gather both sides of that. But the thematic analysis specifically was guided by the six-phase approach proposed by Brown and Clark, so involving taking these very bottom-up codes and then combining them in different manners or ways to try and develop our themes and to identify overlapping concepts or themes to try and come up with their final analysis. So I'll be sharing some of the results so far. So the first aim, looking at determining how pediatric SOT recipients and their families use social media. This is more so that broader look into patterns of use in this population, as well as the types of topics that they engage with. So we were able to describe the characteristics of online users on a very high level, in a very high level sense. As on Reddit, it's quite common for users to actually disclose details about themselves. So that typically involves things like age, gender, year that they received their transplant, perhaps how many years post-transplant they are, and the type of transplant they received, as well as if they were a family member, the type of relationship they had with the transplant recipient. So in terms of type of organ, kidney was most highly represented, followed by heart and liver. And in terms of gender, there was a fairly even split. So 48% identified as a woman or girl, and then 52% identified as a man or a boy. In terms of years post-transplant, the population was primarily 5+ years post-transplant, and then 29% fell into that more acute period. And then in terms of age that they received their transplant, most users received their transplant between the years of 10 to 19, and then a smaller proportion received theirs during the years of 0 to 9 or 20 to 24. So again, this has its limitations in terms of this is all self-disclosed, and there is also a subset of posts that didn't disclose some of this information as well. So weren't able to assess this for all 357 posts that we included in our analysis. We also looked at the most common topics for seeking advice or information. So evaluating the codes that fell under this subset. And here we saw that medical complications or symptoms was the most commonly represented code here, followed by medication, as well as peers or social support, and any topics related to their transplant team or interactions with healthcare practitioners. And just a note here that the N number is the total number of times this code was referenced. So the ones that have higher N numbers were referenced more frequently in this larger bin of seeking advice or information, and then the percent values represent the percent of total. There was also a number of discussions about recovery post-transplant and seeking information about mental health, as well as transplant eligibility or questions about qualifications for receiving a transplant and safety concerns, so specifically safety about engaging in certain quote unquote risky behaviors or safety surrounding COVID. And we also categorized the posts into 5 major bins, and these were determined by myself and then the other coder who had gone through this entire data set, that we determined that there were 5 major categories that these posts fell into. And then we went into the sample again and categorized each of those posts into one of these 5 categories and ensured that we achieved reliability and agreement on that categorization. So those categories included medical or medication, mental health or emotional struggles, posts about interpersonal relationships, posts about long-term outcomes of transplant, and posts that are celebrating a transplant milestone. We also performed a sentiment analysis on the posts that fell into each of these categories, and they're graded here based on their sentimentality. So the most negative being posts about medical or medication, and then the most positive being about celebrating a transplant milestone. And we were also able to assess for differences in types of posts that were shared by different groups that self-identified as different um, roles. So for one, transplant recipients compared to family members, we saw that transplant recipients were more likely to post about things about mental health or emotional struggles, as well as celebrating a transplant milestone, whereas family members were more likely to post about medical or medication related topics. And we also saw that years post-transplant was a determinant in the type of post that was shared. So individuals 0 to 4 years post-transplant, or in that more acute phase, were more likely to post about mental health or emotional struggles, whereas those that were more than 5 years post-transplant were more likely to post about celebrating a transplant milestone. And there were no other significant differences in self-disclosed gender, type of organ, or age of transplant. So really seeing that whether someone's a transplant recipient or a family member, as well as how many years post-transplant they are the greatest determinants in the type of social media activity that they engage in. We also captured any attitudes towards online support groups in general, seeing how this population views online support groups and social media-based support. So primarily seeing that this group was a source of community and connectedness for these individuals, and broken down, it was a place for them to vent about some of their challenges. It could be a source of positivity, hope, or inspiration, as well as a source of true understanding. So what is meant by that is just a place where perhaps someone interacts with another pediatric SOT recipient and they've never been able to connect in that manner with peers in their life before. As well, users often cited a current lack of peer support as a reason for turning to this group, as well as less often it was a source of advice or information. So the majority of time it was either that community or connectedness aspect or that current lack of peer support. It's not really a source of concrete facts or advice about how to proceed with their care. And in terms of drawbacks or limitations of these groups, users cited that they understood that there was limited expertise from other online users. So that could look like just stating that I know that the people in this group aren't medical practitioners, but I am coming on still to share about some of the challenges that I've been facing. And sometimes the group was described as a source of negative emotions or feelings of discouragement. So sometimes seeing the challenges that other transplant recipients faced, users expressed concern or hesitation about potentially falling into that same situation. So now sharing about results from the second aim. So this is looking specifically at those mental health and psychosocial related topics and really taking a magnifying glass on those conversations. So we were able to code for the most frequently shared mental health challenges by online users. And this is separated into the poster or the individual posting the content, as well as the commenters or the individuals that are responding to that content. Again, the percentage here is looking at the percent of the total amount of codes in this category. So the most frequently shared one was fear and worry, as well as anxiety, depression, self-confidence or esteem and body image, as well as trauma. And the patterns largely mirrored for the poster and the commenter, but for the commenter, trauma and emotional challenges or swings were um, cited more commonly, and that reflects current literature that shows that trauma is a quite prevalent concern for this population. And the self-confidence or esteemed body image was something that was notable, as it's typically more present in younger populations or adolescent populations. And we were also able to assess for strategies to cope with mental health toll of transplant. So strategies that users cite that they currently use to try and manage their mental health. So most often that was engaging in meaningful activities. So this quote here looks, the user talks about how they have anxiety and PTSD, but that meditating daily helps with calming their mind. And then the next most common one was a change in attitude or outlook. So this user here talking about how they were facing quite a few challenges, and it looked like they were going to die instead of getting a transplant, but that accepting their limitations and focusing on more positive things helped their mental health quite greatly. Other means to cope with mental health included substance use and peer or family support. And now looking at the thematic analysis, so that more in-depth look into how the pediatric transplant experience intersects with and impacts mental health, we were able to look into more detailed narratives about mental health and some of the underlying themes that were coming up there. So we found that from this analysis, there were three primary themes. The first one being uncertainty surrounding organ rejection and retransplantation. So really, just capturing the deep emotional challenge of an uncertainty surrounding the possibility of needing another transplant, and that there are a lot of complicated feelings in this stage. So things like grief, denial, anxiety, and resignation, and also reflecting on potentially the loss of their transplanted organ and having to face the prospect of needing another one can be quite a heavy burden for these patients. So this quote here, the user talks about how they went through a stage of grief and denial over losing their kidney, and that it's almost a part of them, and they can't imagine how it's now being lost. And a sub-theme for this larger theme was that death is a salient concern for this population. So talking about how it's almost a norm. So this user here talking about how they've grown up around it. It's become almost normal for them, and it's not affected their life because it's they've come to embrace it instead of fearing it. So a means to kind of cope with that um, idea of mortality or that idea of death. And then another sub-theme in this larger theme was coping with uncertainty surrounding organ rejection and the aspect of acceptance. So this user here talking about how they understand that their transplant won't last forever, but that planning, but that they're planning for that eventual outcome, and kind of prompting the rest of the group to not lose faith and that it's really all they've known and that's how they've coped with it. And the second major theme that we've seen was guilt surrounding one's organ donor. So the narratives here highlighting that there is a complex guilt that comes after receiving a transplant. And there's this need to balance the feeling of being very grateful for receiving a life-saving organ, but that there's also this heavy burden that is sometimes characterized by guilt and this need to live up to certain expectations. So this user here talking about how ever since they got their transplant, they felt guilty and they don't feel that they're worthy for receiving the second chance at life, and that mental health has been a struggle. And they actually asked this group to see if there's any tips online or if there's any tips to deal with some of the mental health challenges that they've been facing. And a sub-theme in this theme was weighing gratitude and guilt. So trying to balance that feeling of gratitude towards receiving this life-saving organ with the guilt that they're sometimes facing. So this user here talking about how they question why their life was saved and why they received their organ, but that they're truly grateful for the life that they've received and the different experiences that they've had access to. And the final theme that we found in our analysis was a larger theme of being a young person living with a transplant. So the first sub-theme here was peer and relationship challenges. So generally, the narratives in this category center how the transplant experience and how having this ongoing medical regimen has impacted their ability to engage in peer and romantic relationships, and how that has sometimes led to feelings of isolation or a lack of normalcy. So this user here talking about how um, they feel that suffering from a chronic illness will probably impede in their ability to find a partner and how that can be difficult. And the second one here, the sub-theme looking at body image and coping with physical changes. So often the narratives here talking about how their medication or medication side effects have led to physical changes, and there's this need now to um, find some way to reconcile those physical changes with their current self, and how that has sometimes led to some emotional distress in terms of coping with changes in weight or changes in facial appearance or changes in physical scars. So the quote here talking about how they really love their hair and that's something that they value about themselves, and they feel anxious about um, going out or how they will be perceived. So that aspect of lack of normalcy and losing something that perhaps that you once valued, and trying to reconcile that and cope with that. And the last sub-theme here is meaning and identity formation. So trying to reconcile sometimes the experiences they've had as a young child with who they are now as a potentially an adolescent or a young adult, and trying to integrate a person being with a chronic condition with a person who is growing up just a typical adolescent. So this quote here talking about how they received their transplant at 18 and they're now coming to terms with how it shaped their personality and belief system. So again, integrating that aspect of being a transplant recipient into their identity as a person. So finally here, I'm looking at aim 3, which is to uncover information and resource needs um, to guide the dissemination of mental health resources online. We put out a social media use survey that would specifically ask for questions about the role of social media in the lives of transplant patients and their families. So the types of social media platforms that they turn to, the frequency that they use those platforms, as well as some of the important barriers and facilitators to accessing social media, as well as the perceived helpfulness of some of those online tools. So we're still in the early phases of the analysis for those results, but so far 33 participants have completed the survey, and we're seeing that there's a really some really interesting perspectives in terms of how social media is viewed in the community. So certainly a lot of hesitations about the credibility and privacy of information that is shared online, but also weighing that with the potential benefits. So having a um, really accessible community and potentially also using it as a educational resource. We're seeing that in terms of the motivations for turning to social media, so some of those topics that users seek out or share are quite common to what we see with our social media analysis. So centering some of those medical experiences, experiences with medication are still some of the primary concerns for the participants of the survey, as well as the users of that Reddit transplant support group. But here, I just wanted to show or share some of the differing types of perspectives on social media and the different attitudes towards it. So this participant here stating that they've steered away from social media because it's been difficult emotionally. So to see the deaths in transplant community, um, that it's a really heavy burden for them, and that it's almost a reminder of some of the negative outcomes that might be pending, and that I believe mirrors some of the attitudes that were shared in that our transplant group, where sometimes social media was positive in that it could promote community, but that it was also could elicit negative emotions. So these feelings like um, seeing the negative outcomes that some other community members have faced, and that eliciting some emotional burden or challenge. There's also some participants that shared that social media is potentially beneficial for them, and that for this parent, they believe that having that sense of community is really important, that it could be really beneficial to have some sort of virtual environment where recipients and their families can come on and connect with other members of the community. So, in summary, the study shows and demonstrates how pediatric SOT recipients and their families use social media. So, more broadly, in the sense of their patterns of engagement, the types of topics that they engage in, the types of topics that they seek out and share, as well as describes the unique mental health challenges of these patients. So, specifically, how elements of their transplant experience, so the aspect of potentially needing another transplant, receiving a transplant from others, and the guilt associated with that, as well as the experiences of a young person with a transplant, and how that intersects with mental health. We were able to further describe that with the data set, as well as exploring different strategies used to cope with mental health challenges. So things like engaging in meaningful activities, changing their attitude or outlook. So potentially a way to um, bolster current strategies that patients are currently using to try and manage their mental health, as well as to potentially guide clinical conversation about that's more specific and tailored. So touching on not just general mental health challenges, specifically how they intersect with the experiences and the unique experiences they've had as transplant recipients. and also hoping to allow the survey results to try and guide the development of potentially online tools or to support healthcare practitioners in understanding how to provide recommendations in terms of how to navigate online spaces as social media use is so ubiquitous now. Um, but there are certainly hesitations in terms of things like privacy, credibility of information, as well as potentially eliciting negative feelings or reactions. So, recommendations on how to navigate those spaces safely and effectively. Um, as well. So I just wanted to acknowledge my supervisors, so Dr. Tom Blight Hansen, as well as Dr. Julie Robillard, my co-supervisor, as well as both the solid organ research team and the neuroscience engagement and smart tech research team here at UBC, as well as BC Children's Hospital Research Institute and the CIHR for funding this project. So now I would like to thank everyone for listening to my presentation. I would be very happy to take any questions if there are any.
That was an excellent presentation. I'm going to open the floor to any questions, either in the chat or by virtually raising your hand. So as people are digesting all of this, or maybe Erica can get us started.
Yeah, Erica can get us started. Great presentation. Really enjoyed it. On your second objective, you went over some of the findings that you found, themes that were present. Were any of these surprising to you? And also, were there some themes that you expected there to be there that you really didn't see?
Yeah, that's a really great question. I think going into it, I I started off with doing just a literature search of mental health challenges and the lived experiences of transplant patients, and I think generally there wasn't too much in terms of is mostly more on the quantitative aspect of just describing the incident of mental health challenges in this population, but less so on the front of trying to qualitatively describe those challenges. So I think going into it, I was really surprised at how I guess robust the data set was and how there was these really like complex and in-depth narratives that were shared online, and really that openness I think was quite surprising. Um, so I kind of went into it with maybe not too much of a lens. I really wanted to be very open and trying to go in and analyze the data set. But I think when I brought up some of these emerging themes or some of these quotes and these topics to my supervisors, they actually went in and they felt that they actually represented a lot of the conversations that they've had with their patients, and that some of these topics were um, kind of how they felt they were heavy on the hearts of their patients. So things like interactions with their donor or feeling that anxiety surrounding potential rejection was a really persistent concern, but not something that maybe is as well described in literature, as I do believe it's more so on that quantitative front. So I think being able to qualitatively describe some of those challenges and assess them more specifically. So um, of course, trauma is a persistent concern in this community, but it intersects with aspects of a transplant recipient's life. So I think that's important to contextualize and understand. So I think it wasn't. I was surprised at how maybe robust and honest some of those conversations were. But I think once I had some of those conversations with my supervisors, I was really able to um, kind of understand that they are persistent concerns in the community and are conversations that are had in clinic, but maybe not so much represented in the literature.
Thank you.
I'm going to ask more of a naive question as more of an outsider. And this is more so what exactly exists in the standard of care when it comes to mental health support? Because judging by all of these themes and everything that these recipients go through, having mental health support is imminent. So, what's the standard of care at the moment? And does it vary in different locations or practices? And a second part to this question is related, but how has healthcare professionals, clinicians received this kind of information from the research that you've done, and how willing are they, or what are kind of the ideas and steps they're interested in taking to actually incorporate this with their current standard of care?
Right. No, again, that's a really excellent question. Touching on the first one, I am not too knowledgeable about other centers, but at BC Children's, I know they do routine mental health screening, and there's a on-service psychologist and social worker that can work with the patients at the clinic, but that there's frequent screening for patient-reported outcomes when it comes to quality of life and PTSD or trauma symptoms. Um, and with the second question about how this information has been received by the clinical team, this project is part of like an ongoing set of projects where um, it started with a project looking at the mental health profiles of children in the clinic at BC Children's. And then from that, they saw that there was high rates of trauma and PTSD in the population. And then they did a more in-depth look at that, finding that quality of life and PTSD were implicated. And then that led to a more interview-based study on PTS. And um, so far, I think that's being received quite well by the clinical team, where there has been this openness to try and incorporate things like more regular screening of PTSD and PTS in the patient population. Um, and I haven't had the chance too much to disseminate this to the clinical team so far, but I think that it's certainly in line with some of the work that has been done previously. And there is that very direct translational path as well. So to try and highlight some of the potential results or potential implications of the study, but also understanding that there is this hesitancy surrounding social media use and specifically social media use in young people. And there is just that like kind of more conservative nature towards that. But I think with that, it's understanding that social media use is so common in young people and children, and it's almost inevitable at this point that patients and their families are going to turn to social media um, in some aspect of their life. So to try and provide recommendations on how to navigate those online spaces, as well as there are ongoing projects in the team looking at the development of online tools. So I know that there's a text-based community that is being developed. So to try and inform the development of those tools with things like, what are important topics for this community? What topics does this population turn to social media for? So seeing that medical complications medication are quite common topics, potentially those are things that should be brought up or touched on in any online based tool.
That was lovely and really thorough, and it really just shows how much impact and implications this project has. I'm going to ask if anybody else has any more questions before I read out a comment from the chat. It seems that we don't, but I am going to read out a comment from the chat from Alicia, Transplant Life. This is a former pediatric transplant patient now working in virtual transplant patient support, and they just want to thank you for doing this work. It was such an enlightening presentation. And with that, if we don't have any more questions or comments, I'd like to propose ending this session. So I would like to thank everybody for their engagement, questions, and comments throughout today's presentation. And Irene, on behalf of CDTRP, thank you again for presenting and for the work that you're doing. If anyone has additional comments, questions, or suggested topics from speakers, you can contact Erica Croft at ekcroft@cdtrp.ca. So with that, I'll end off, and thank you, everyone. Enjoy the rest of your day.
Thank you so much. You all take care.